Jim Kremidas needs almost no introduction to this industry. He's currently, though, the adjunct graduate faculty member, Wake Forest Clinical Research at Wake Forest University. He was also the executive director for many years at the Association of Clinical Research Professionals, where I got to know Jim very well. He's also worked at Quintiles, Eli Lilly, and been all over the place. He's a fine musician, a wonderful guy, and we're honored to have him as our first guest on Clinical Trial Report. We had the chance to talk to him very recently about his experiences on the other side of clinical trials. So Jim, again, thank you so much for joining us on our very first episode. It's a real honor to have you.
Well, it's my pleasure to be here, Michael.
So let's talk about your recent experiences. Now, you've been in the clinical trial industry for a long time. Then you had some health issues that if you could talk to us a little bit about, and then I'd like to talk about your experience on the other side of a clinical trial.
Sure. Well, it's almost ironic, that I'm now a participant in a clinical trial when I just retired. I'm still doing some teaching and some consulting, things like that, but I'm not working full time anymore. And actually it worked out quite well from a timing perspective because it gives me time to participate in the trial without having any real conflicts, with work schedule kind of thing. But the bottom line is I've been a very healthy person my entire life. And as you know, worked in clinical research for many years. And then about 2 years ago, I got a diagnosis of non-muscular invasive bladder cancer, which was kind of a surprise. I mean, it came out of nowhere, but they pretty much ran me through the traditional standards of care. There's a procedure called TURBT, I had that done. And then normally somebody would go on BCG, which is a compound, or it's actually a bacteria that gets your immune system to respond to the cancer cells in your bladder. Unfortunately for me, that didn't work. So after being on for about a year, they discovered the cancer had come back. And at that point, the doctor that I was seeing in Indianapolis suggested a clinical trial. And so I did a little research, talked to the physician who was the primary investigator, et cetera, and thought this is a great opportunity. I mean, not only could I do something that would be helpful to science and people that experience this disease going forward, it might help, so there's a certain level of hope that one has. There's a certain level of, paying it forward. I used to talk a lot about that when I was in the clinical trial business. So it's been interesting to go all the way from, working at a sponsor to working at a CRO to working with sites, now to actually being a patient in a clinical trial.
Well, first, I want to thank you for your bravery and your transparency here. It's really great you're talking about this, and hopefully it'll be inspiring to other people. Let's talk now a little bit about your trial experience. Now, one difference you have with many people is you don't have, as you said, you don't have the work schedule issue, and that's a challenge for people trying to participate in, for some people trying to participate in trials. But yeah, talk, if you could, about, I'm sure, same with me, we think we know clinical trials really well. I've never been through one yet either. What have you learned so far going through it that might have informed you in your career earlier, or for others watching?
To me, it's been interesting in terms of dealing with the health system. The things that we hear about, going through in the informed consent process, that was very well done. They did a great job explaining the study. I feel like I do have a slight advantage in that I know the kinds of questions to ask, because of my experience. But I try to put myself in the shoes of somebody who really didn't have any experience in this area and the kinds of things that they would be curious about. And a lot of it was explained up front. Most of my questions had more to do with, believe it or not, the science. I was kind of curious, like, what's the hypothesis here? What are you trying to prove? What's this drug do? Yada, yada. So I probably asked some unusual questions of the study coordinator. But, the thing that I have found.
Did they know about your background?
Yeah, I told them. Yeah. But the thing that I have found most interesting has been sort of the way that I get moved through the various elements of the healthcare system that's conducting the trial. So, I go to urology for certain treatments. I go into the lab to get a port put in for some of the other treatments for, like IV things and blood draws, stuff like that. And it's interesting that each department is a little different than the other. I don't think it's a question of them not communicating, because I'm sure they use the same EMR system. But it's interesting that they all have sort of their departmental SOPs. So for example, I get weighed at the beginning of the day on a visit, and then I get weighed 2 or 3 more times throughout the day. I mean, it's not it's, it's no hassle, but it's just like, why do they need to keep doing that?
Right.
It's their SOP, I'm sure. Same with blood pressure. I get my blood pressure going through these things, like taken 2 or 3 times in the different departments that I'm in. So that sort of says to me that, it's not that the left hand doesn't know what the right hand is doing, but it does say that there are certain procedures that are more in the clinical care arena that somehow get translated into the clinical trial as a participant's going through. And again, fortunately for me, that's nothing invasive or, that causes any issues from my perspective. It was just an interesting observation. And I could see where if there were some things that were more invasive and, less pleasant, how that could be detrimental for a patient or in terms of their experience.
Now, throughout your career at ACRP and before and since, you've been a big cheerleader for this industry. You've always talked about what a higher calling it is for clinical trial professionals. I wonder now what you would like to say to the clinical trial professionals now that you've been on the other side involved in a clinical trial.
Well, pretty much we've been saying all along, it's really wonderful when you have a nurse or a coordinator or a physician who talks to you, like they're your friend. It's almost like you've got somebody there who's advocating for you, who's trying to do the right thing, who's trying to do the best they can. Fortunately for me, I have not had any really bad experiences in terms of dealing with the people, other than, some delays and things like that, which frankly probably didn't need to happen. It was a bit annoying, and I voiced my opinion. I said, hey, there's no reason I should have had to sit here for 2 hours. But there's plenty of people who wouldn't step up and say that, and I can see why a lot of people would say, this is not convenient, it's not fun, I'm not really getting anything out of it, I quit. So establishing that relationship between the study site staff and the patient, I think, is really, really important. And I don't think that's news to anybody. The whole concept of patient centricity has been well known for a long time, but executing it's a whole other story. And again, fortunately for me, the people I've been dealing with have been fantastic.
All right, before I let you go, and again, I can't say how much I appreciate this on so many levels. For your trial, what's the problem? I mean, how long is it? A 6-month trial, a year trial, or what's the narrative on your trial?
Yeah, overall, it'll take about a year. So the way it started was obviously a screening visit. And then there was 6 weeks of treatment with oncolytics once a week. And once a month, I'm getting an immunotherapy. So the 6 weeks of the oncolytics is over. The 6 months of the immunotherapy, we're halfway in. And at 3 months, which is my next visit, I'll be getting scoped to see if there's any more cancer and whether or not the therapy is working. If it is, I continue on for a couple more months. And then basically they're going to look, they told me after the second scope, which would be 6 months in, then they would decide how often I would need to keep coming back for follow-up. It's up to the urologist to decide that. But they'll know whether the therapy is working. Actually, that would be 4 months in. Will be time for my 4th dose when they do the observation to see if the cancer cells are still there. So technically it's 6 months, but there's a follow-up period probably every quarter for at least the next 2 quarters. So it'll probably be about a year, and maybe it may even go beyond that in terms of follow-up, as if any type of cancer, they're going to follow up either every 3 months, 6 months, or once a year. I'm not sure where it goes from there.
All right. Well, promise me you'll come back in 6 months and share the good news you have to share with us about how well it's going. Okay.
I hope so. Either way, what I was saying earlier, either way, there's scientifically, something's going to be learned from this study. And interestingly, I actually talked to the PI the last time I was in. There are a lot of other bladder cancer studies going on right now with different mechanisms of action to address the cancer cells. So, if this one doesn't work out, I think I may look and see if there are other studies that are possibilities that I could qualify for. So we'll see.
All right. Well, thank you again, Jim. Just inspiring. And thank you so much for your time and for everything you've done in your career up through this very moment and in the future as well. Thank you again.
Sure thing, Michael. Thank you.